We have arrived at the last plenary session of the day. The plenary 5 will be chaired by Dr. Mrs. F. Sri Saravana and will be presented by Dr. Premini Rajendran under the topic Maintaining Good Looks in New Normal. I now kindly invite the chairperson to conduct the session.
Good evening. Dr. Premini Rajendran is a consultant, District Hospital, Negombo. She graduated from University of Jaffna in 1999 and obtained her MD in dermatology in 2006. She is a vice president of Sri Lanka College of Dermatologists and she was immediate past joint secretary of the Sri Lanka College of Dermatologists. And she authored few chapters in the Atlas of Dermatosis in Pigmented Skin. Her special interests are leprosy, acne, and pigmentary disorders. She will present the topic which is important for the current situation to care the skin. Over to you, Dr. Premini.
Thank you, Dr. Felicia, for the kind words of introduction. First, I would like to thank President and Council of the Jaffna Medical Association to give me this opportunity to present this prestigious forum. Now I am sharing the screen. So the topic is maintaining good looks in the new normal. The skin, being the outermost organ, reflects our overall health. The quest for beauty is as old as the civilization itself. This pursuit of beauty and good looks is prevalent in society today, even amidst the pandemic. We are currently in the midst of a pandemic and therefore experiencing various skin-related issues due to personal protective measures and change in lifestyle. Routine skincare has also been neglected, which is necessary to maintain good skin health. In my presentation today, I will be discussing skin issues related to personal protective measures, some common skin diseases on the uncovered part of the face, and some facts about routine skin care. As the country has reopened, but still the pandemic continues, we are forced to continue to use the personal protective equipments and hygienic measures to fight against the COVID. So why do face masks cause skin problems? So face mask compromises the skin barrier. Skin barrier may be compromised due to the increased humidity and temperature which is created by breathing in the closed environment behind the mask. And the friction and continued friction and pressure effects can cause mechanical effects. And the other contributory factors are the type of mask, duration of mask use, and pre-existing skin problems like acne, rosacea, seborrheic dermatitis, and atopic dermatitis. So mask-related skin problems, they're commonly present with facial itch, erythema, and maceration, especially when they continuously use the mask for more than 4 hours. Contact dermatitis may occur due to the dye and the synthetic fabric made of mask. Contact or pressure urticaria, aggravation or induction of acne, aggravation of pre-existing skin diseases, cognerization of vitiligo or psoriasis, and mechanical skin damage. Now we will see one by one. So the mask-related acneiform eruption is called maskne. It has given a special name, maskne. So new observation of acne can occur due to the humidity and temperature elevation created by breathing in a closed environment between the facial skin and mask, leads to the occlusion of the pores. So this occlusion, it is an ideal environment for the Propionibacterium acnes to grow, and this leads to the formation of acneiform eruption. And another type of acne reported in the pandemic is the stress-induced nodulocystic acne, which forms a large nodular lesion on the chin and the jaw area. This exacerbation of pre-existing skin conditions. This picture shows worsening of the seborrheic dermatitis can occur due to the overgrowth of the malassezia furfur behind the mask. And other conditions also can be aggravated. Other pre-existing conditions like atopic dermatitis, acne, and rosacea also can be aggravated by continuous mask use. And other cause for the aggravation of these existing skin conditions are the high stress, especially those who give care directly to the COVID-19 patients. They are more stressed out, so they are more prone to get this aggravation of these pre-existing skin conditions. So the mask-related Kopner phenomenon. So the friction-induced skin lesions, these lesions are induced by the friction, which is found on the normal skin, similar to clinically underlying skin disease, which occur on the previously uninvolved sites. Due to the friction, they get the new lesion in the uninvolved sites. It is reported in the case of psoriasis and vitiligo following mask use. So the mechanical effects are, we can see in the pictures, pressure indentation, erythema, and sometimes they develop skin breakdown following the continuous use of the goggles and N95 masks, especially in those who give direct care to the COVID-19 patient, and they need to wear these masks for more than 6 hours to get this kind of reactions. They heal with the post-inflammatory hyperpigmentation, and sometimes if they develop skin breakdown, when they heal, they will end up with mild scarring as well. So how can face mask reactions be prevented? So we need to use a mild facial cleanser to cleanse the skin, because already our skin is in an irritated state. So we need to use a mild facial cleanser, especially before we wear the mask and after prolonged wearing of the mask. And after each cleansing of the face, applying moisturizer, it's a non-comedogenic moisturizer is recommended. If it is a comedogenic moisturizer, that can induce the acne. And use a lip balm before you wear the face mask. And we should take frequent breaks from the mask whenever possible. Ideally, the pressure from the face mask and other personal protective equipment should be offloaded every 4 hours whenever possible. So their work schedules can be made according to that. And we need to choose the appropriate mask, that means it should fit to our skin appropriately. And the fabric also important when we choose a mask. 2 to 3 ply tightly woven cotton cloth masks are recommended those who out in the community, but that is not recommended for the healthcare setup. Minimize reuse of face mask. Ideally, they recommend at least 2 masks should be used in a day. And avoid facial makeup. Actually, we don't need facial makeup under the mask. It just at another layer and can cause irritation of the skin. So hand hygienic measures is another important tool in fighting against the COVID. The measures recommended are the hand washing, hand sanitizer rules, and use of gloves. So what are the adverse effects of frequent hand washing? It disrupts the skin barrier. It disrupts the epidermal permeability barrier and as well as the microbial barrier. And it has effect on skin pH as well. So this picture shows the architecture of the healthy skin and the unhealthy skin. That is, unhealthy skin is the skin which exposed to recurrent hand hygienic products and exposed to recurrent hand washing. So as you all know, epidermis contains 4 layers. The topmost layer is the stratum corneum, which forms the skin barrier. So the skin barrier contains corneocytes, flattened corneocytes, which is embedded in the lipid. And on top of that also there is a lipid layer. So what happens with the recurrent hand washing? The recurrent hand washing using hand hygienic products, especially soaps and detergents, the proteins in the corneocytes are denatured. And the intercellular lipids and the surface lipids are washed off. And there will be that corneocyte cohesion will be impaired, and the water retaining capacity also reduced. So there will be more trans-epidermal water loss, lead to dryness of the skin, and it allows the more irritants and allergens to penetrate the skin, come to the layers of the skin and cause dermatitis. And when the skin is damaged, the usual pathogenic bacteria is replaced by pathogenic bacteria. So the effect on skin pH, the skin pH is usually maintained acidic. With recurrent hand washing with alkaline soap, the skin pH increases. This causes again swelling of the corneocytes, destabilization of the lipid bilayer, leading to the epidermal barrier disintegrity. So the hand dermatitis usually present with the dryness, erythema, scaling and fissuring. Some complain itching and burning. So it can be irritant contact dermatitis or allergic contact dermatitis. So when the skin barrier is impaired, it allows the irritants and allergens to go into the skin, which leads to the dermatitis. The irritant contact dermatitis is the common type of dermatitis we see. Rarely we see the allergic contact dermatitis. It is a late reaction, usually due to the preservatives and fragrances found in the hand hygienic products. And in the case of gloves allergy, it is mainly due to the latex or formaldehyde found in the gloves. So what are the preventive measures? When we choose a hand hygienic product, choose a hand hygienic product with less irritating properties. Several studies have shown that alcohol hand rubs with humectants, that's a type of moisturizer, is tolerated very well by all. And frequent moisturization of hands. The moisturization of hands is recommended after each hand wash. And when the skin is damp itself, we have to apply the moisturizer to hold the moisture. And hand moisturization is indicated even after each hand sanitizer use, but in that case, we have to wait for the sanitizer to dry off completely to apply the moisture. So the moisturizers which contain petroleum and mineral oil are recommended for good effect, and avoid the dye and fragrance containing moisturizers. So the other effects of pandemic, the recurrence lockdown, quarantine measures, and change in work from home, all lead to increased screen time and poor diet and lack of exercise. And other effects from the pandemic is the forced COVID hair loss, the hair loss which occurs from the COVID-19 infection. So especially during this pandemic, we spend more time indoors and in front of the screens than normal. So blue light emitted from the cell phones, computer screens, and other digital devices. So what is blue light and why we talk more about this blue light now? So blue light is a part of the spectrum of a visible light, which is the spectrum is between 400 and 500 nanometer. The main source of blue light we expose to is sun, but in addition, we expose to a substantial amount of blue light from the digital screens and indoor lighting. So is blue light damaging your skin? Yes. It stimulates the production of free radicals. By that, it accelerates the aging. So skin is the major target for oxidative stress, and the link between aging and oxidative stress is well documented. And it induces the blue light, induces the melanogenesis, which cause hyperpigmentation and aggravates the melasma. But these effects aren't always noticeable right away. The damage is cumulative. And how much blue light you are exposed to not only depend on time, but also depend on the screen device and the setting what we use. So the blue light is not always harmful to skin. It has beneficial effects on the skin. Blue light is used in the treatment of skin diseases like precancerous condition and the skin cancer conditions. We use photodynamic therapy. Blue light is used in the photodynamic therapy. A photosensitive agent is applied on the skin lesions before blue light is emitted. And blue light also used in the treatment of acne. The bacteria, Propionibacterium acnes, which is involved in the pathogenesis of acne, emits its own photosensitizer. So it is amenable to the blue light treatment. So whether you admit or not, the lockdowns and the quarantine measures allowed us comfort, unhealthy food, and lack of exercise, which leads to the weight gain. So poor diet and lack of exercise can lead to obesity. So these are the skin problems related to obesity: acanthosis nigricans, intertrigo, jock itch, stretch marks, varicose veins, capillaritis, plantar hyperkeratosis, acrocodones, and cellulite. These days, we encounter more adults and even the children coming seeking treatment for darkening of the neck. The acanthosis nigricans is characterized by velvety hyperpigmentation of the flexural areas and extensor surfaces. It is not a disease per se, but it is associated with other diseases and conditions. Like it is associated with endocrine and metabolic disorders. It can be associated with genetic syndrome, familial. Can be associated with malignancy or drugs. It can be benign or malignant. The benign one is called again pseudoacanthosis. It is the common one we see. It is usually associated with obesity and insulin resistance. A thorough workup is necessary if malignant acanthosis nigricans is suspected. In malignant acanthosis nigricans, the onset is abrupt and the involvement will be extensive with the involvement of the oral mucosa and palms and soles. So the treatment correct the underlying disease process, and weight reduction is one of the important treatment modality in the case of acanthosis nigricans. So weight reduction itself can reduce the benign acanthosis nigricans, pseudoacanthosis nigricans. And the topical agents which are in use in the treatment of acanthosis nigricans are retinoids, vitamin D analogs, alpha hydroxy acids and keratolytics, chemical peels, and lasers also can be used in resistant cases. The post-COVID hair loss. So it occurs 2 to 3 months, hair shedding occurs 2 to 3 months after recovering from the COVID-19 infection. Hair fall occurs in large clumps and the patient rush to us because they think that they will go bald. They lose that much of hair. It is due to transition of energy. But what happens here, phase, that is the growth phase, to the phase, resting phase. This resting phase lasts 3 months. That is the reason why they start to lose the hair after 3 months. So the hair shedding will continue up to 6 to 9 months. But this type of hair loss, we tell the patient that you should be happy about it because most of them regrow this. It spontaneously recover, and by another 6 to 9 months, they will get their full volume of hair back. So next, I'm moving to some of the skin conditions which are on the uncovered part of the face, especially around the periorbital region, around the eyes, forehead, and cheeks, which are not covered by the mask. So periorbital darkening, dark circles. So it usually occurs bilaterally and it is common in dark complexion people. So the cause is multifactorial: genetic, post-inflammatory hyperpigmentation following atopic dermatitis or allergic contact dermatitis, periorbital edema, excessive subcutaneous vascularity, thin low eyelid skin, sunken eyes, shadow effect, skin laxity, and prominent tear trough. So the treatment is a challenge. So treatment should be directed towards the most underlying factor, most obvious underlying factor. So topical lightening agents can be used in the case of post-inflammatory hyperpigmentation, and dermal fillers can be used to treat the tear trough. And other treatment modalities are the chemical peels, laser, and PRP can be tried. So this slide shows us the before and after treatment pictures where the dermal filler is injected to the tear trough. So we can see how aesthetically pleasing appearance after treated with the dermal fillers. So the periorbital darkness has reduced, and the groove also, we can't see the groove after treatment. So the next condition, which usually occurs in the uncovered part of the face, is the melasma. It is a very devastating and psychologically depressing condition. It's chronic and recurrent disorder of hyperpigmentation, mostly occur in females of reproductive age. Excessive amounts of melanin are laid down in the epidermis and dermis. The risks and trigger factors are genetic predisposition, sun exposure, skin phenotype, especially the skin phenotype, dysphatic skin phenotype, 3 to 4 are more prone to get this pigmentary disorder. And the hormonal factors, pregnancy, oral contraceptive pills, and hormonal therapy also can precipitate the occurrence of the melasma. Usually, the melasma which occurs in the pregnancy, most of them get rid of it when they deliver the child. So again, the management challenging here, as it is a chronic recurring condition. So the multimodality approach is required. One of the most important treatment modality is the photoprotection. So here we need to choose a broad spectrum sunscreen which gives coverage to the visible light as well. And the other treatment modalities, the first line treatment is a skin lightness, 4% hydroquinone and triple therapy as the prototype skin lightness. And second line treatments are the superficial chemical peels, and oral tranexamic acid also can be used if they don't respond for the skin lightness. And the third line are the lasers and light treatment. So the forehead wrinkles, these are dynamic hyperkinetic lines due to the repeated contraction of the frontalis muscle due to repeated facial expression. So with time, these dynamic lines become static. So these dynamic lines should be treated before they become static. So botulinum toxin is used to treat these dynamic lines, and it acts by hemodinervation of muscles by preventing acetylcholine release at the nerve ending. So this slide shows the before and after pictures of treatment with the botulinum toxin. And this again, the glabellar lines are treated with the botulinum toxin. We can see how their face looks nice after the treatment. So the other condition, which is a very embarrassing condition, especially to the females, is the developing terminal hairs in a male pattern. So luckily during this pandemic, they can cover most part of the face, like where they grow these terminal hairs, especially on the upper lip, chin areas, but the sideburn areas, we won't be able to cover with the mask. So the causes, there are so many causes. but out of which the polycystic ovary disease and idiopathic are the common causes for the hirsutism. So it's a clinical diagnosis, but may need investigation in some cases, like when we suspect ovarian or adrenal gland tumor or congenital adrenal hyperplasia. When we take the treatment, as any other disorder, we have to treat the underlying disorder. Then usually the oral systemic treatments, the oral contraceptives and anti-androgens, which are used to treat oral agents, treat the hirsutism. It usually takes 6 months to see a significant improvement in the hair growth. The topical cream eflornithine, it only slows down the new hair growth. The laser therapy effectively delays hair growth for long periods, but we need multiple treatment at the beginning to reduce the hair growth and may need maintenance treatment as well. But during this pandemic, we are not amenable to get laser therapy because we need to attend the laser clinics frequently once a month. But most of the clinics are now closed, and while the social distancing measures are still in action, so the laser therapies may not be available at the moment for some time. So they have to adapt the dermatocosmetic treatment methods. So these are the dermatocosmetic treatment measures. They can adapt these methods at home: hair bleaching, shaving, depilation, waxing, plucking. Now I have come to the skincare routines. The frequent lockdowns and work from home, so we usually neglect our usual skincare routine, which is necessary to maintain the overall health skin. So the cleansing, moisturizing, photoprotection are the three main important skincare routines. So the cleansing, gently wash your face when waking, before bed and after sweating. Now we have to say after removing the mask also. Use a mild cleanser. Already our skin in an irritated state, so better to use a mild cleanser. Wet the facial skin with the lukewarm water. Apply the cleanser with the fingertips. Avoid vigorous scrubbing. Pat dry with a clean towel. So after the cleansing, we need to moisturize the skin. So moisturize after each cleansing. Choose an appropriate moisturizer according to your skin type. If you have oily skin, lightweight gel-based non-comedogenic moisturizer work well. If you have a dry skin, go for a cream-based one. Apply a lip balm prior to putting on a mask. Avoid makeup. It only soils the mask and clog the pores. If you need to use a makeup, use a tinted moisturizer or choose a non-comedogenic oil-free product. The next important skincare routine is the photo protection. You can see in the picture, if you don't cover the exposed, uncovered part with the photo protection, you will see the skin tone differences after heavy sun exposure. So choosing a sunscreen, you need to choose a broad spectrum sunscreen which covers the ultraviolet A and ultraviolet B. If you have a pigmentary disorder, you have to cover the visible light as well. Choose a sunscreen which has the sun protection factor 30. The sun protection factor number is a measure of protection against ultraviolet B rays. And as I said earlier, pay attention to your skin type. So each type of skin needs different type of sunscreen. So there are two types of sunscreen, inorganic and organic. Inorganic sunscreen act by reflecting or scattering the infrared, ultraviolet and visible light. But organic sunscreen act by absorbing the ultraviolet light. The organic sunscreens are not less acceptable because of the opaque nature. After applying the inorganic sunscreen, you will get a whitish appearance on the skin, but the organic sunscreen are well accepted by the clients. But nowadays, most of the sunscreen has both inorganic and organic compounds. Sunscreen application, we need to apply the sunscreen half an hour before going out. Reapply every 2 hours after swimming or after heavily sweating. Apply enough sunscreen as an even layer. We should not forget other methods of sunscreen. Wear a wide brim hat, use a ultra protective sunglasses and sun protective clothing. So few words about the skin aging. Skin aging is induced by both intrinsic and extrinsic factors. Intrinsic aging is genetically determined and it is an inevitable physiological process. But eccentric aging is due to the external agents such as solar ultraviolet radiation, smoking, air pollution, stress, and malnutrition. 80% of the extrinsic aging is due to the photo damage, so it is given another name, photo aging. So this computer generated picture compares the sun protected and sun exposed skin. We can appreciate more skin damage on the sun exposed area, so which shows the importance of regular usage of sunscreen as part of the regular skin care. So how to care for your aging skin? Apply sunscreen, quit smoking, eat a well-balanced diet, regular exercise, and use of effective cosmeceuticals. So topical pharmacological agents with anti-aging properties. So the retinoids have shown in studies that retinoids is a well-known product which has anti-aging properties, and many studies also supported the anti-aging property of the retinoids. And the vitamins, vitamin C and B3, hydroxy acids, peptides and proteins, grapeseed extracts. So after the age of 30, this anti-aging cream should be part of the armamentarium of your routine skin care. And we should not underestimate the other factors which are important in maintaining the good skin health, like adequate sleep, stress-free life, a well-balanced, healthy diet, and stop smoking. Hope I would have given you tips on maintaining in the new normal. Thank you.
Thank you, Dr. Premini, for your interesting and informative lecture and enlightened with dermatoses which are related to pandemic. And we have conclude this session and wish you all for looking good. Thank you.